This video will cover the Spinocerebellar tracts, including the posterior and anterior Spinocerebellar tracts. These are ascending tracts, so carry information from the periphery to the brain. These tracts carry unconscious information, so we are not aware of it, but the brain is using information to coordinate our body. Both the posterior and anterior Spinocerebellar tracts sit in the lateral white column of the spinal cord and carry information up to the brain for processing. The posterior tract in the spinal cord receives information from the lower limbs and carries the information up through the medulla of the brainstem, through the inferior cerebellar peduncle, and into the cerebellum. The tract does not cross over, so takes information to the same side of the cerebellum. The tract provides the cerebellum in the brain with unconscious proprioceptive information from the lower limbs. This allows the brain to know where the lower limbs are and therefore keep us coordinated. The anterior Spinocerebellar tract also carries information from the lower limbs. This tract decussates, first in the spinal cord, then travels up into the cerebellum where it decussates once again. This is referred to as a double cross and means that the information from the limbs is carried to the ipsilateral, so same side of the cerebellum. Damage to the Spinocerebellar tract would lead to a loss of muscle coordination. However, this is unlikely to occur alone, and usually patients will have damage to the descending pathways as well, causing muscle weakness or paralysis that may cover up the damage to the Spinocerebellar tracts. A patient damages the lateral white column of their spinal cord, severing the posterior Spinocerebellar tract on the right side. What symptoms would they experience, and on which side? Pause the video if you need to. They would have a loss of muscle coordination in their lower limbs on the right side, since the posterior Spinocerebellar tract does not decussate. Another patient is injured and damages their spinal cord, specifically severing the anterior Spinocerebellar tract on their left side. What symptoms would they get, and on which side? Pause the video if you need to. Again, they would have a loss of muscle coordination in their lower limbs. This would be on the same side as the lesion. In summary, the Spinocerebellar tracts carry unconscious information about the limbs to the brain. Both the posterior and anterior tracts carry information from the lower limbs. The posterior tract does not decussate and carries information straight to the cerebellum. The anterior tract decussates twice, once in the spinal cord and once in the cerebellum.